Welcome to Brownish Parenting with Dr. Amita. This show is going to unpack the real and raw experiences of South Asian American parents raising their bicultural children. So today's episode is especially meaningful to me because we are speaking with someone who's going to help us rewrite the story of mental health in our South Asian American community. We're going to explore how therapy can really be culturally responsive and how emotional patterns can show up in bicultural families, how parents can begin showing up for themselves and their children in more emotionally aware ways and intentional ways. So many of us grew up in households where sacrifice was the norm, where putting your own needs first was actually labeled as being selfish. And so children learned early not to express boundaries because they were raised by parents who never felt that they had the right to set their own boundaries. So the cycle just continues until we consciously interrupt it. And so today I want to dive into conversations that often stay buried, right? Like the difference between healthy guilt, which gently signals to us that we've acted out of our values, and toxic guilt, which keeps us trapped in shame, silence, or obligation. And so in many Desi households, elder sons quietly carry this heavy burden of caregiving, expected to provide without really voicing their own emotional needs. And daughters are socialized from a young age to become caretakers, often praised for helping out around the house, watching over their siblings, or putting others' needs first. And so parents sometimes mirror the sacrifices that they expect their own children to make. And over time, with the praise, this can turn into pressure. Whether you're a son who feels responsible or the daughter who feels like she can't say no, this kind of guilt can often get mistaken for love or duty. We want to change this narrative because your needs and emotions also deserve space. So, we're going to talk about how to start setting those boundaries, especially if it's something you have never done before. And for many of us, we haven't done this because setting a boundary can feel like betraying your family. But in truth, it's one of the most loving things you can do for yourself and for them. And so today I want us to expand how we think about therapy. We often hear about talk therapy, but that's just one piece of the puzzle. Many South Asians carry trauma that's emotional, it's historical, it's embedded in our nervous systems. And so I want to talk about some different therapeutic approaches today that might speak to our community more deeply. So the ones that we typically know of are the talk therapies, which is cognitive behavioral therapy, CBT, which can help us recognize and change negative thought patterns and behaviors. Dialectical behavior therapy is DBT, which is great for people that are dealing with very intense emotions or relationship struggles, and it can blend acceptance with change. But beyond these more common approaches, you're also going to find healing in narrative therapy. So, narrative therapy can help you separate your identity from the problems that you faced in the past and reframe the stories that you tell about yourself. Internal family systems is another therapeutic approach where the self is made up of different parts, and it can be inner child, it can be the fixer, it can be the critic. And this helps bring healing to wounded parts of who you are that have been developed to protect you from when you were young. There's also EMDR, eye movement desensitization and reprocessing, which is a trauma-informed therapy that helps the brain reprocess de-stressing memories so that they no longer trigger these overwhelming reactions. Now, this is particularly interesting for the South Asian American population who often has experienced traumatic experiences like child abuse, neglect, especially emotional neglect, domestic violence, migration stress, also just deep-rooted intergenerational pressure that's carried on. And these experiences usually get minimized or they never really get named because we're often told to move on rather than process that pain. And so what happens with EMDR is that you don't have to retell that trauma in detail, but it's actually a process that's nonverbal, it's body-based, and it helps clients really reclaim that peace and power from the experiences that they may have silently carried on for years. So we're going to pause for a break. And when we come back, I'd love to introduce you to our guest, Shruthi Nair, who is a mental health counselor. Welcome back. Our featured guest today is Shruthi Nair, a limited permit mental health counselor based in New York, currently practicing in Greenberg Psychological Services. Shruti is a second generation Indian American and the daughter of immigrants. She brings a deeply personal and professional lens to her work, particularly in supporting BIPOC clients, many of whom are navigating bicultural identity, intergenerational trauma, and complex family dynamics. She works primarily with adults facing anxiety, depression, life transitions, chronic health conditions like PCOS, and thyroid disorders, as well as issues that are tied to self esteem, guilt, people pleasing, and shame. She is also known for helping her clients contextualize their identities and reclaim their stories. All right, welcome, Shruti. I'm so excited to have you here. I'd love to start by just learning a little bit more about you, your upbringing, and what brought you into the work that you're doing today. So, if you could just talk to us about being raised in a bicultural household.
Yeah, absolutely. Well, first of all, I just want to say thank you for having me and
Yeah.
thank you for that lovely introduction. So my story actually starts in I grew up in the suburbs of New York,
Oh.
my entire life, I would say 18 years
Mhm.
of my life. And for most of my childhood, I was the one and only two brown kids in my neighborhood, which was
Mhm.
challenging. And that really shaped in sort of how I saw myself. So I internalized a lot of insecurity. I struggled a lot with self-worth because I was really
Oh.
trying to fit in with the kids who really didn't share my background. And as a teenager, or as being in middle school, like our priorities are
Yeah.
to be the popular kid or to fit in. And so that's
Yeah.
exactly what I did growing up. And I remember feeling like I had to hide parts of my South Asian identity. So,
Mhm.
like, whether it was as simple as eating with my hands, like I wouldn't share that with
Yeah.
my friends, with my teachers, like nobody knew, or like
Mhm.
things like oiling my hair or
Yeah.
watching Indian cinema, or even like speaking like Malayalam, which is
Mhm.
the my parents' mother tongue, like I wouldn't share that with anybody outside of the home.
Yeah.
And so that really made me feel like I was living two lives. So one at home
Mhm.
and another one outside. And navigating that divide was just really confusing and isolating. And I'm sure that it's
Yeah.
such a common experience for
Yeah.
children of immigrants who feel as if like their own existence is almost like a tug of war when
Yeah.
they're just surrounded by those who identify only as American, for
Mhm.
example, or those who identify only as South Asian. And those I'm specifically focusing on South Asian American because
Yeah.
that's what I know best. That's my personal experience. But there could be many other, of course, bicultural identities as well.
Yeah, yeah. No, I mean, I definitely related to your story because I grew up in Walnut Creek, which is a suburb in the Bay Area, mostly Caucasian. And I know what like hiding my identity feels like and not feeling like you belong in either space that you're in because either, you're trying to be really American, but then when you come home, your parents want you to be more South Asian and they're denying that part of you, saying it's like, in a way bad, right? Like you're being too American when you do certain things. And yeah, and it wasn't until I found people that were more like me that I felt a little bit more of that belonging. Yeah,
Yeah.
yeah. The shared experience that I thought I was only, experiencing for myself and didn't really have many other people to relate to. Thinking about that, like, I guess what messages did you receive about mental health and emotions growing up? Like, was there conversations at home around that?
Yeah, such a good question.
Yeah.
I felt like I received a lot of messages, but
Hmm.
there was one primary message that I received that really impacted me, which
Yeah.
was this idea that if you hold on to negative emotions, so like sadness, anger, frustration, like none of those were welcomed.
Yeah.
It wasn't something that we talked about openly in the
Hmm.
household that I grew up in.
Hmm.
If anything, I would say the unspoken rule was if you're struggling, push it down, move on.
Yeah.
And while that might have seemed like a way to keep the peace in the
Hmm.
family system, it just left a lot of room for emotional invalidation. And eventually, I would say that it really built up a lot of resentment and sort of disconnection from myself and also from others as well.
Yeah, no, I definitely feel that too. That a lot of, in just in collectivistic households, it's very much that you want to show positive emotions. There's this story of gratefulness, being grateful for what you have, and If you are, for me, if I tried to tell my mom I was having problems, she often told me to go pray, but there wasn't really dialogue around it. So that's why it's really hard for me to still have the words for those negative emotions that I'm feeling. And it just leads to a lot of just uncomfortability. And I didn't even have the word for resentment, I think, for a while to know that that's what it was, as you were speaking about it. And so, given all these experiences you had, how has that identity, your bicultural identity, and conversations around emotions, shaped your decision to become a therapist?
Yeah. So honestly, a big
Mhm.
part of it was feeling like I never truly fit in. So that dialogue really struck a chord in me.
Yeah,
Um, so
yeah.
as a South Asian American, as I said earlier, I was really straddling with these two worlds. And
Hmm.
that came with a lot of challenges, right? Like there were so many times when my Western values, which I would identify as being independence, emotional expression,
Yeah.
perhaps even setting boundaries, clashed with
Hmm.
South Asian cultural norms, such as like
Yeah.
social harmony, tradition, humility. And so that tension really just impacted my confidence and my sense of self.
Yeah.
Really wanted to understand that experience better, and
Hmm.
not just for myself, but for others like me.
Hmm.
And so that really was sort of my mission. And so that's kind of led up to me and
Yeah.
myself going on this journey of becoming a therapist. Because it just really allowed me to kind of support people who are navigating the same
Yeah.
cultural and pull, and also just working through generational trauma, cultural
Hmm.
guilt, or just trying to figure out who they are in spaces that I would say at least don't always make room for the complexity that it deserves.
Yeah, yeah. And I like how you kind of talk through some of those values, like the individualistic versus collectivistic values, and where do we see ourselves in that? Because they're in direct contrast with one another, that independence versus dependence on others and focusing on self, focusing on others, being, humble, but then also being competitive and being out there, emotionally expressing yourself. So there is a lot. There's a lot for the South Asian population when you think about that and that tension, that push and pull. And I'm wondering if, in your experience, are there therapeutic models that work better for South Asian Americans when you think about some of these, complexities that you talked about?
Yes, definitely. So I actually practice using almost 4 or 5 modalities. There's
Oh,
so many more.
yeah.
Those five I would identify are IFS, narrative therapy,
Oh,
EMDR, and
uh-huh.
CBT and DBT. Those are the top five that I use in my practice. And what I have seen are those structured protocols. So
Mhm.
EMDR is really structured. CBT is also structured. And I'll get into the specifics of each of those
Yeah,
so our listeners can get a better
yeah.
idea on what those modalities are all about. But those structured protocols I found to be very effective because
Okay.
many South Asians, such as ourselves,
Yeah,
we don't even, as you said earlier, we don't necessarily have the language
yeah.
to describe our emotions
Hmm.
necessarily. And so
Hmm.
things like EMDR, which is very nonverbal or focus more nonverbal
Hmm.
cues, can be very helpful. It's like a good starting point sometimes to start there, versus IFS. Is more really targeting the deeper
Hmm.
under the surface sort of themes. And I'll go more into depth in just a moment. So let
Yeah,
me first start with what EMDR is.
yeah, that'd be great.
And
Yeah,
I will break down all the other terms that I shared in
yeah.
just a bit. So
Okay.
EMDR is, as I said, it's a very structured protocol, and it's
Hmm.
it's really the gold standard for trauma.
Okay.
And it's often this idea that using bilateral stimulation, like
Hmm.
eye movements, tapping, or even sounds, can really help an individual reprocess very painful memories from their past.
Okay.
So it's this philosophy that if we allow our brain to reprocess the memory in a way
Hmm.
that reduces its emotional charge,
Yeah.
it can actually help you feel more grounded in the present. And so I do want to preface as well
Yeah.
by saying, even if it is the gold standard for trauma,
Hmm.
it can be used for those who struggle with anxiety. It has been shown to be effective for those
Hmm.
who struggle with low self-esteem, depression. So it is a modality that is used wide, like worldwide. So
So I just
That
have a
being
few questions. Yeah, because you talked about bilateral, and just for people that have never heard, because I know EMDR is just so, it's a new concept for me too. And I've heard people explaining it where you're moving your eyes from left to right, or the tapping would be bilateral, like left and right, correct?
correct. That is correct. Yes.
And they're walking you through maybe a memory that you had that you don't have language to really describe, but it's something that caused a lot of activation in your nervous system at
That
the
is
time.
correct.
Because
Yeah.
sometimes, even for me, like I think back to my childhood, there's things that I can't really describe, or maybe you don't remember fully. But
Mhm.
this therapist is walking you through it and having you think about it without having to tell them. Is that correct?
Yeah, that
Okay.
is correct. So it is also, I just want to emphasize this
Yes.
point as well of it's not really about retelling the
Uh-huh.
traumatic experience because
Okay.
I think that's a misconception.
Yeah.
It's more about just reprocessing that traumatic
Mhm.
memory without needing to explain it in full detail. So you're really just allowing the client to sort of just feel whatever they're feeling, whether it's like emotions in their body or it's
Mm.
it's another memory that pops up. Wherever
Yeah.
you want to go, you're just sort of as a therapist, just
Uh-huh.
creating this really safe space for them to process it in a way that is accessible for them.
Okay.
But it can be intense. So not to say that
Yeah.
it's a cake in the, cake in the park or whatever.
Yeah.
It can be very challenging. So as a therapist, we're just really
Yeah.
being mindful of that
Hmm.
it's more also about teaching
Hmm.
folks who engage in this type of therapy to
Yeah.
learn these like calming exercises, grounding
Hmm.
exercises as well. So that's part of EMDR as well.
Okay.
And
And then the
so
therapist is walking you through, like you're here, you're in that space right now. This is coming up. And then they're also walking you out of it. Is that correct? Like they're also giving you ways to calm that nervous system down when you get there. Okay.
absolutely.
Yeah.
And the client has full agency of
Yeah.
whether it does get intense sometimes. They have full agency to pause as well and take
Okay.
a break and then resume again. So sometimes I think EMDR, even though it is structured, there are moments where we
Hmm.
might, as a therapist, we might use other modalities to help themselves as well when they're getting really having intense emotions towards the trauma
Yeah.
that they're holding on to.
Okay. Great to kind of think through how this would work. Because again, like South Asian Americans have so much trauma that they may have experienced. And this is one way where sometimes they don't want to talk about it, but it's still there and it lives in their bodies and it can get triggered at any time. And you don't know what's happening. And this is one way to see is this going to help me? Can this address some of the things that I'm feeling on a daily basis?
Exactly. Yeah.
Yeah.
And
Yeah. And do you want to go into like any of the other ones that you think would resonate well with South Asian Americans? Because I feel like, you talked about narrative therapy and integrated family systems, and just historically, when we think about our own identities, like when we talked about our own upbringings, there was, limiting beliefs. There was things where we felt like we weren't enough. We had low self-esteem. It all stemmed from the stories we told ourselves in our minds from a very early age.
yes,
Yes.
absolutely.
Yeah.
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 So I like using IFS. So that
Hmm.
stands for internal family systems. It
Okay.
is trauma informed as well.
Hmm.
And it's basically kind of understanding your inner world as a system of parts. So it's this idea that you and I and everyone around us have so many different parts that
Yeah.
make us,
Hmm.
basically. And so each part has its own perspective, emotions, and purpose, but sometimes we don't always have a great relationship with it. And so it's
Yeah.
really getting into at the core, it's
Hmm.
based on this idea that we all have this term called the self, and the self
Hmm.
includes it's grounding, it's compassionate, it's curious. And so our goal in IFS is to reach this idea called the self, and
Hmm.
for the self to allow itself to
Hmm.
look at each of these parts in a very curious, compassionate manner. And as I said, it's challenging, right? As a self,
Yeah.
we we take up we might be holding on to so much burden, guilt, shame. And so
Yeah.
those are the parts that I'm sort of referring to. And so some of these parts that we have found to be unhelpful now may
Hmm.
have protected us in the past, or it may have helped us cope or carry those past burdens. And so it's really trying to build that insight from within for each individual. So I'll just
Yeah.
share a few examples
Hmm.
on how this can show up among South Asians. So,
Yeah.
for example, it's like these statements like, I want to set boundaries, but I feel
Hmm.
guilty and ungrateful, or I want to marry for love, but I also fear disappointing my parents, or I want to
Uh,
rest, but a part of me feels lazy or selfish. And so IFS helps you meet all of
interesting.
those inner dialogues
Hmm.
with not shame, but curiosity. Allow yourself to really understand, like, where is this coming from? Like, is it
Yeah.
coming from my outside world? Is it what I have witnessed in
Hmm.
my so instead of choosing between them, you're learning to understand and honor that voice.
Oh,
So it's really carrying this
yeah.
internalized voices and challenging it and being compassionate, understanding. And so
Yeah.
there are different parts that show up, like we tend to use language like
Hmm.
the achiever, the pleaser, the critic, the
Yes.
exile.
Yeah.
I'm sure many of our listeners might relate to some of those. And
Yes.
it's really this idea of, okay, great, I know
Yeah.
what my parts are, I know where that comes from, but how do I speak to it, right?
Yeah.
What's my dialogue? And that dialogue
Mhm.
matters because that can really impact how you feel on a day-to-day basis, not just
Mhm.
within yourself, but also in the context of just South Asian families, for
Yeah.
example. So,
Yeah. Your yeah, decision making, setting boundaries, like you just talked about, some of the things I think about with South Asians is achiever, being the achiever, feeling like you always have to be. So this idea of then being able to rest or just having time to spend on self-care is something they don't do very often. People pleasing, right? That will probably be really hard when you want to set boundaries for yourself, because you feel like the other is more important. So I can definitely see how this could be so helpful and how has been ingrained in us. And it's like that whole idea of the subconscious and how you may be limiting yourself in your own life to really reach your full potential. So I love the way you explain that and the different parts of who we are. And then you also we talked about internal family systems and EDMR. Oh, narrative therapy was the another one you said, right? For South Asian
yes.
Americans. Yeah.
Yeah, so narrative therapy is very helpful,
Hmm.
only because I think often us as South Asians, we carry this specific narrative that sometimes our parents or people who are really close to us sort of shared with us. And it almost, just as you said earlier, we come
Hmm.
from a collectivistic culture. And so
Yeah.
sometimes we carry that forward and we almost feel as if, oh, okay, like that's our narrative too, but that's not
Yeah.
always the case. And
Hmm.
that's where the tension begins, right? That's
Yeah.
where that internal struggle
Yeah.
gets started. And so it's like, okay, well, what can I do? How can I
Hmm.
heal that? And so a part of what I do with folks who I see on a daily basis is using narrative therapy, which means that we are really allowing them to take ownership of their
Hmm.
own life and their own journey. And so it's really being able to explore, okay, like what are the dialogue that you have right now? How does that fit within the value system that you're
Mm.
onto? And
Yeah.
some of the value system
Yeah.
may be pulling from the South Asian background or South
Yeah.
Asian culture, but some of it maybe not so much, right?
Hmm.
All have our own journeys. We sometimes leave our family systems and we're in
Yeah.
with the world. And so
Hmm.
of course, we're going to have different perspectives, but
Yeah.
sometimes it doesn't always align with the South Asian culture. And so a lot of this is really taking, and this is a really helpful sort of technique that I
Hmm.
use in my sessions, which is really allowing each client to kind of create chapter titles
Ooh.
of their own story. And what a lot of folks realize is, wow, I would never have
Hmm.
sort of come to terms with that. I
Yeah.
thought it's all I had was my family's narrative, but
Hmm.
I said no, this is my
Yeah.
narrative. This is how I became who I
Yeah.
am. And so I use that technique quite often because that
Hmm.
really gives the client this sense of empowerment, which is often
Yeah.
missing in when we're part of a collectivistic system.
Yeah.
Not always, but sometimes, for
I
sure.
love that. Like this whole idea of you are the author of your own life story, your life narrative. And even when so my own dissertation was on bicultural identity and like really understanding how individuals became teachers. And what I found was that it's what you were saying about these values that they had to kind of think through the value of wanting to do this profession that maybe their parents did not approve of, which the ones in my study did not, but then also valuing what their parents did approve of, which was more education. So maybe they got the teaching credential, but they also got that master's in education for their parents. And were they navigating this complex system of values to make sure they could really be part of both worlds and honor both worlds in their own way? And
Mhm.
so I think that's awesome. Like it's like, and what came up was you're living in a third space. We are creating our own third space when we do this, right?
Yes,
And I
exactly.
think I wanted to kind of pause and talk a little bit about guilt because I think what happens when we are trying to navigate this narrative that our parents have told us our whole lives that this is what our story will be, and then we try to do what we want to do with our own narratives and our own chapters in our lives. How does guilt play a role in South Asian Americans moving forward with their narratives?
Yeah, so this one is really challenging.
Yeah.
Many
Yeah.
of us hold on to this, but before I go into how to manage it, I think it's helpful to create a distinction between different types of guilt.
Yeah.
Because I think there is a narrative around that guilt is bad, and that's not always the case.
Yeah.
And so it's like this idea between healthy guilt versus toxic guilt. So
Mm-hmm.
healthy guilt shows up when we have done something that goes against our own values. So
Yeah.
it's the kind of guilt that helps us grow. So, for
Mm.
example, if you said something hurtful in your argument and you
Yeah.
later reflect that, oh, that's not how I want to show up. Okay, like that guilt
Mm-hmm. Mm-hmm.
motivate you to
Yeah.
apologize, to repair, to do better.
Mm-hmm.
So I like to define it as grounded in accountability and alignment with your core self.
Okay.
Taught guilt, on the other hand, is when you feel responsible for someone else's emotions, decisions, or expectations. So even
Yeah.
if you haven't actually done anything wrong, it's
Mm-hmm.
this voice in our mind saying, for example, if I set this boundary, I'm a bad daughter. Or if I prioritize my mental health, I'm selfish. And so
Mm-hmm.
toxic guilt is often rooted in external pressure,
Uh,
cultural conditioning, or this fear of being seen as disrespectful or ungrateful. So
mm-hmm.
oftentimes I share with folks that healthy guilt is about your actions, toxic guilt is about your existence. And so
Okay.
in bicultural households,
Yeah.
the guilt can get really sneaky. You might be doing something that's completely normal in one cultural
Mm-hmm.
context, like saying no to a family event, and still feel this heavy emotional weight. And so
Yeah.
that's not because you've done anything wrong. It's because you've been conditioned to believe that your worth is tied to self-sacrifice. So a big part of
Mm-hmm.
therapy or working on that part of
Yeah.
learning to differentiate between the guilt that signals repair versus the guilt that's simply trying to keep you small. So a lot of this is really framing it a
Uh-huh.
bit differently for yourself.
Mm-hmm.
But also a second part of this, which according to me,
Yeah.
is really grieving this reality of I can bring up all these conversations with my parents, with my uncle, with my auntie,
Wow. Yeah.
folks. However, what if they never understand?
Yeah.
And often folks feel very defeated by
Mm-hmm.
having these conversations because they believe that, oh, they will understand, they'll understand. And that's the first part, or I would say the
Mm-hmm.
second part
Yeah.
of dealing with guilt is letting go of that, kind of coming to terms with this reality,
Yeah.
because sometimes coming to terms with that reality and grieving that this
Mm-hmm.
is reality will allow you to let go of the pressure
Wow.
of
Yeah.
having these small conversations. And so instead, it's thinking about as well intention versus outcome in these moments.
Interesting. I feel like it is, as you were talking about the guilt, first, in collectivistic households, they do experience more guilt than in individualistic households, which I think is so interesting in the research. They say we experience a lot more. And then thinking through, am I experiencing, I think, well, like for me, I don't know if I would know the difference between am I experiencing healthy guilt or toxic guilt. And you talked about action versus existence. So like I guess what does that look like with an example?
Yeah, so action, so I said intention versus outcome because
Yes.
that's very helpful. So,
Okay.
for example, that might mean like, okay, I'm bringing up a tough conversation with my
Hmm.
parents. Like, oh, I really want them to support my decision in pursuing, let's say I want to become an artist, for
Yeah.
example. They're like, I really want them to understand, and I don't want to become a
Hmm.
doctor, for example. So often it's like this idea that no, I need my parents to understand like where I'm coming from, why I want to become an artist.
Hmm.
But their world might look a little different. Their priorities
Yeah.
will look a little bit different as well. And so a huge aspect of this before you even have this conversation is
Hmm.
really allowing yourself to grieve. And when I say grieving, I
Yeah.
really mean letting go of those emotions. Allow yourself to express yourself in
Hmm.
spaces you can. And that may not look
Yeah.
like being at home, maybe, not
Yeah.
necessarily. Maybe that means being in therapy practice
Hmm.
in this
Yeah.
space where you're allowed to release that emotion. And that is the
Uh-huh.
first step. The second
Okay.
is really thinking about intention is very helpful. And this
Ah.
applies to even
Hmm.
setting boundaries with South
Hmm.
Asian families as well, which is often especially when we're coming from two different generations, we sometimes have this puzzled look of
Yeah.
they saying X? Why are they
Yeah.
saying Y? And
Yeah.
it's really sometimes coming from a place of love, sometimes
Hmm.
place from a place of really caring for yourself. But as
Hmm.
I always say, regardless of whether it's positive or negative intention,
Yeah.
can still have a negative outcome. And so a lot of this is allowing yourself to sit a little bit more with the
Hmm.
intent and then move forward with the conversation. And maybe that's something I
Yeah.
can share with your listeners around
Yeah.
what certain steps you can take to have
Mhm.
these conversations as well.
Yes. Oh, that would be helpful. Yeah, if you could just walk us through some of those steps and the grieving process is just grieving the expectations that may your parents have for you that are not meeting your needs in the moment. So a lot of this sounds like also just thinking through what you want for your life, like going back to the values, journaling, making sure that this is something yeah, that you're going forward with this. And now let me grieve before I bring this conversation up. Yeah. Okay.
Yeah, so there are usually like 6 steps, and I
Hmm.
usually share this off the bat. But again, I just want to,
Hmm.
let your listeners know that it doesn't always come this smooth.
Okay.
It's not one, two, three necessarily, but it is a
Hmm.
nice foundation to just learn,
Yeah.
especially if you're afraid
Hmm.
of bringing up these conversations, which is common
Yeah.
in South Asian households.
Uh-huh.
So first step is acknowledge and appreciate their intention. So,
Hmm.
if you can't find one that is, helpful, you may have to dig a little deeper. So that's something to keep in mind. So,
Hmm.
for example, this might sound like, Mom, Dad, I know you care and you and worry a lot, which is why you always give me advice. There we go.
Yeah.
Simple, like a
Okay.
simple
Yeah.
statement such as that.
Yeah.
Second step is addressing how the intention impacts you using I
Mm.
feel statements. This is the part that feels
Yeah.
risky for many us as South.
Yes.
You're like, oh gosh, we're
Yeah.
using the I statement. Like this is getting a
Uh-huh.
little too personal.
Uh-huh.
And this is also where people fall into a trap of blaming by
Hmm.
making you make me feel statements. So we're not
Mm.
saying you make me feel X. We're
Yeah.
saying I feel this. And
Hmm.
often I will use language like instead of using but, I would use like and. So I might say,
Yeah.
and even though, mom and
Yeah.
dad you're giving me all this wonderful advice, and it makes me feel overwhelmed, and it makes me feel more stressed out. And
Yes.
so
Yeah.
sometimes using that language makes the
Hmm.
I statement a little bit leveled out a bit more, and you'll
Okay.
feel a little bit more confident because I like to call the other steps as your opportunity to allow that I feel statement to
Mm-hmm.
not feel as daunting. And I'll speak about it in just a
Mm-hmm.
moment on what that's going to sound like. So that's step
Okay.
number two, I feel
Yeah.
statement.
Uh-huh.
Step number three is offer a solution or assign them a different role if it
Mm-hmm.
fits. So, what does this sound like? This can sound like it would really help me if you let me handle these things on my own, or it will
Mm-hmm.
really help me if you call me once a week instead of three times a week. And
Yeah.
so this again, this is another step that
Yeah.
feels folks get a little bit scared. They're like, whoa, like
Yeah.
this is getting a little too much. But the fourth step is the
Uh-huh.
most important piece of this whole thing, which is
Okay.
clarifying any unspoken assumptions, right?
Okay.
So this is the part where shame can come in,
Mm-hmm.
and we want to take an opportunity to address it. So,
Okay.
for example, this might sound like this doesn't mean that I don't care about your advice, or it doesn't mean you're bad parents if you're hands off.
Yeah.
You don't check in every week. It just means I want to just be more independent or take care of this myself. Or
Mm-hmm.
sometimes, even if you say that, it's sometimes drawing some parallel experiences with your parents or your
Yeah.
auntie, your uncle, or your friends, whoever it
Mm-hmm.
is, sometimes can be helpful because
Yeah.
often parents, one, raised us to be
Mm-hmm.
independent, to
Yeah.
really
Uh-huh.
basically live our everyday life. And
Yeah.
this is a great opportunity to address all of that. Because I'm sure step number two and three, your parents or
Mm-hmm.
whoever might have a certain reaction. They might be like,
That's true. Yeah.
this, right?
Uh-huh.
So that's when the step kind of, I like
I
to call
love
it.
that. Yeah.
So step number five is
Uh-huh.
iterate what you would like moving forward. So
Mm-hmm.
you might say, for the future, I would like you to trust me to handle
Mm-hmm.
this by not always telling me what to do regarding this
Yeah.
topic, for
Yeah.
example. And
Mm-hmm.
last step, invite them to collaborate with you. So
Mm-hmm.
you might say, how does that sound to you? Or does that seem fair to you? And I just want to also
Yeah.
emphasize you can use whatever language feels
Mm-hmm.
comfortable to you, because maybe the language I'm
Yeah.
sharing right now may not be the way you speak, and that's okay.
Yeah.
It's more
Yeah.
about the basic ideas that
Mm-hmm.
sort of stressing here, I think can be very helpful as a
Uh-huh.
starting for a lot of
I
folks.
love that. It's like this passing this ball back and forth. Like you're starting this conversation, you're getting it going, you throw it to them. Like, I really do value your advice.
Yes.
They throw it back to you. You're able to tell them, hey,
Mhm.
this is what's going on with me. I feel like this. You're not blaming them. You're not saying, you're doing this to me. You're holding that ball and you're keeping it with you. And you're like, I feel overwhelmed when I get this many phone calls in a day, and this is what I need from you. And hey, I know you want me to be independent, throwing the ball back to them and
Mhm.
moving that conversation forward and co-creating at the end. How does this sound for you? Is it like this is what would work for me? What do you think about this? And as you talk about it, so like step two and three, I wanted to talk a little bit about boundaries. And I know that can feel it is a boundary. You're setting a boundary for what works for you. And South Asians have a hard time with boundaries. Any experiences with helping South Asian clients through boundary setting? Because it can feel selfish when you're in a collectivistic culture.
Yes, definitely. So
Yeah.
I would say, I mean, this one is such a common theme that I see all the time of like, I don't want to appear to be selfish. And that's sort
Yeah.
of where I kind of suggest to really frame it a little bit
Hmm.
differently. Sometimes can be very helpful.
Yeah.
So going back to the CBT work, the cognitive reframing techniques that I love using in my work with folks is really being able to say, okay, well, what if you don't set the boundary at all? What's been going on emotionally for you? What's coming up for you? And
Yeah.
often folks will share, well, I feel overwhelmed, I feel stressed out, I don't feel seen,
Yeah.
invalidated. All of these uncomfortable emotions start surfacing. And so
And
often,
just going back to CPT, because I know we didn't actually define it earlier. If you
yeah.
could just define, like, that's the most common sort of talk therapy that usually happens, and it's about changing negative thought patterns, right? Okay. And was
Yes.
there anything else you would add to that?
No, I would say
Okay.
it's also a pretty structured protocol, so it can be very
Okay.
helpful for South Asians as well. And so it's very helpful to it's a modality that is used to challenge a lot of core beliefs that,
Okay.
as we're talking about right now, with South Asians holding on to shame, feeling selfish if they
Yeah.
set the boundaries. Like these are core beliefs. So
Uh-huh.
that's where CBT can be helpful to practice framing some of these things in a more helpful manner. And so it takes some time
Mhm.
to reach that goal. However, it is very effective.
Yeah, 'cause it sounds like a
Um,
lot of self-awareness to notice what's happening in your mind to start that process. And if can you differentiate between that and DBT, the
yeah,
dialectical? Hmm.
of course. So CBT is all about this belief that
Yeah.
whatever the thoughts, the behaviors, and the emotions are all interconnected.
Hmm.
DBT, on the other hand, there's a more of a heavy focus on skill set and this philosophy that two things can happen at the same time. So I can feel, for example, frustrated and disappointed
Hmm.
all at once, or I can feel jealous and I can feel anxious. Both emotions can
Hmm.
coexist.
Okay.
Um, and it does not matter which situation you're in. So that's like
Hmm.
the best way I can explain that in a very
Yeah.
simplistic manner. And often DBT focuses a lot on mindfulness, distress tolerance skills, interpersonal
Yeah.
effectiveness skills, so many skill based. So if
Yeah.
if if you're an individual that loves to learn how to regulate ourselves, which often South
Hmm.
Asians we didn't grow up learning how to cope with our emotions.
Yeah.
This is such a helpful modality, and I use it quite often in the work that I do with folks.
Okay. And then for boundary setting, that would you place that more under CBT?
Hmm.
Yeah.
So I
Okay.
would place that more in CBT, mainly because we're really challenging the thoughts,
Yeah.
reframing, really looking at boundary setting as an opportunity for you to honor not just honor yourself,
Hmm.
because that can sound a bit selfish, but more about really thinking of it as you boundary set or you practice boundary setting with family, you're actually going to become a lot more present with the family that you have. The
Yeah.
events, like many South Asians, we have so many family events,
Hmm.
Diwali and
Yeah.
other traditions that we tend to practice. And so it's really being able to say, okay, you know what? I'm going to take time for myself so then I can give more to you. I can provide for you. I can be more present with you, which is exactly if you go back to the collectivistic
Yeah.
roots and values, that's exactly what we're all about, right? We're all
Yeah.
about this supporting each other, being there for each
Hmm.
other, honoring each other. And without honoring yourself, it's really
How can
asking
you
the
do that?
question, can we honor ourselves? Is it even sustainable if we dismiss that? So
Yeah.
it's really being able to ask those questions. And sometimes those questions can really lead to a lot of insight for a lot of individuals.
I could totally see that. Like we emphasize harmony with others, but then how do you do that when you don't have harmony within yourself? And I know boundaries, sometimes that term seems very Western. And so I've heard of therapists
Yes.
saying maybe we don't want to use boundaries. I always see it as like what will help me give myself harmony when I'm at an event, like you're saying, like when you're at an Indian party, and what is a boundary I need to set to make sure I can be in harmony when I'm there instead of just acting like I'm in harmony on the outside. And are there common boundaries that South Asian Americans start to set for themselves when you work with their clients? Is there anything that you see as common?
Yeah, absolutely. So there's one that's coming up for me
Hmm.
right off the bat, mainly because I work with a lot of folks who struggle with body image. And maybe this is something that you resonate with, perhaps,
Hmm.
where you're in these big events, Indian weddings, maybe other celebrations, and aunt, your aunt or your uncle or your parents are like, oh no, eat more, eat more.
Yeah.
And they're coming from a place of
Uh-huh.
love and affection.
Hmm.
And they feel fulfilled, they feel content, they
Hmm.
feel so happy and joyful
Yeah.
as you eat away.
Yes, yes.
Or that does come with often folks start developing like a negative relationship with their body
Mm,
and their thoughts.
mhm.
And that can be really, really difficult at times as well. And so it's really about opening up these conversations
Yeah.
and to open up these conversations, it goes back to sort of very similar structure in how you would communicate boundaries as well. So it kind of goes back to those ideas, challenging those
Hmm.
unhelpful beliefs. And again, I want to preface by saying all
Yeah.
of this is very hard for a
Yeah.
lot of folks to
Yeah.
do, especially in our communities, but it's really being able to almost like build that courage. It takes a lot of courage to
Yeah.
overcome these emotional barriers that we're talking about.
So for these like Indian aunties or uncles that are like eat more, would it be similar to kind of the six steps where you kind of are telling them that I know you really want me to eat, but
Mhm.
I'm full and I don't want to eat anymore, and it's one of those things. Okay. Yeah. Yeah.
Yes, not like, mhm.
That's great. Okay. And then just to end with just looking at some emotional patterns or beliefs that maybe South Asian parents often struggle to unlearn, is there anything that you see in your work?
Yes.
Yeah.
So one major belief are South Asian parents, they often struggle to unlearn that love equals control.
Mm.
So many were raised to believe that if you love someone, you protect them by making decisions for them, for example, whether
Yeah.
that's about career, marriage, or how
Yeah.
they express themselves emotionally. So
Yeah.
from the child's perspective, that can be feel a little bit stifling because
Mhm.
even if it's well intentioned, like it can be also harmful as well. So helping parents understand that love can also look like trusting your child's choices is a huge shift as well. Another belief I have noticed are, again, emotions, especially negative ones, should be suppressed. So many
Ah,
parents grew up in environments where survival came first and not
yeah.
emotional expression. So
Uh-huh.
sadness, anger, or even vulnerability might be seen as weakness or even disrespect in their
Yeah.
world.
Yeah.
So it can be difficult for them to witness their children naming their feelings or
Yeah.
setting emotional boundaries without seeing it as a personal attack. So that's a huge one. And there's also this deep-rooted shame culture around
Mhm.
this quote unquote, what will people say?
Yeah.
And that fear of judgment can also drive so many parenting decisions. So from
Mhm.
discouraging therapy to pushing
Yeah.
kids towards more socially acceptable paths. So unlearning that also means separating personal worth from
Mhm.
community validation, which is not easy when your
Yeah.
identity has always been tied to family reputation. And
Yeah.
the last one I will also point
Mhm.
out is many South Asian parents, they internalize this idea that sacrificing yourself is noble. So when their
Mhm.
children prioritize rest, mental health, boundaries, it can feel foreign and sometimes
Yeah.
even selfish. So helping parents see that
Mhm.
self-care does not mean you're abandoning your
Yeah.
family, but you're rather taking responsibility for your well-being as part of this emotional unlearning process that I'm referring to. Mm.
Yes. Wow. You have given us so much to think about when we think about all the things we need to be unlearning to be able to move forward, really. And I love the tools that you gave us with the six steps and how to have conversations, the differences in guilt that we feel, and how to start to differentiate them. Therapy plays a really important role we could see in the different versions of therapy that you also address with us. Thank you so much for sharing all your powerful work that you've been doing with South Asian American families. I'd love for listeners to be able to find you, follow your work, if you could share how they can connect with you.
Yeah, absolutely. So they can follow me on at Bold Brown Therapist on Instagram and TikTok, where I really share a lot of the mental health content. And if you're interested in scheduling a
Mhm.
consultation call, or if you're interested in starting therapy and your therapy journey, perhaps you can get in touch with me by visiting my website. So it's www.shruthinair.com.
Awesome. Thank you so much, Shruti. Thank you to all our listeners for tuning in. Let's continue to build a community where emotional well being and cultural pride go hand in hand. Thank you for being our guest, Shruti.
Thank you so much. I loved being here.